Okay, good afternoon, everyone. Welcome to ACCM e-learning channel. I am Dr. Ankit, and today I am going to discuss important aspect of ICU, the calcium metabolism. How does it happen, and what is hypocalcemia? This is the first part in which I will be discussing about the calcium metabolism, the calcium homeostasis, how it happens, and what are the clinical features of hypocalcemia we see. In the second part of this particular lecture, which I'll be uploading later, we'll be discussing about the treatment part of the same with a little bit of division of the same which we have discussed today. Okay, so let's see why there is a need of calcium in the body, right? Because I'll be explaining all these points in the further discussion here. Because the calcium is a calcium messenger system which regulates the cell function, right? It activates the cellular enzyme cascades. Smooth muscle and myocardial contraction also happens because of adequate levels of calcium in the blood. It helps in nerve impulse conduction, and there is secretory activity of exocrine glands. This also happens because of normal levels of calcium in the blood. Okay, so these points I'll be discussing in the further coming slides. Now, what about the physiology of calcium? This is an important concept here. We all know that our body is composed of bones, muscles, skin, and everything, right? So we can say that 98% of the body calcium is in the skeleton, as we can importantly see. Or I can actually write it as actually 99% of the body calcium is in the skeleton, and it is in the form of hydroxyapatite. Okay, and out of this particular concept, only 2% is there in the circulation, right? So this 2% of the circulatory calcium level in the body, it will constitute around 0.99% or exactly 1% of the calcium which is extracellular. Okay, and there is only 0.01% of the calcium this is intracellular. Okay, these points, these numbers actually has a value, and they are important because we will see how there is extracellular calcium levels which are present in the blood and the interstitium, and what type of extracellular calcium present in the blood and interstitium. Okay, how they help in the normal physiological functions of the body, the normal cellular processes of the body, right? So we'll see. So as to summarize these points, 98% or approximately 99% of the body calcium is in the form of hydroxyapatite, which is present in the body skeleton. Only 2% of this particular calcium is present in the circulation, and as I told, half of this is free calcium, or we call it as ionized calcium, right? Now, this particular point is important, which I'm going to discuss. Ionized calcium is the only physiologically active calcium which is responsible for the cellular processes of the body, right? And out of this, 1% of the calcium is bound to proteins, which is the albumin, as we all know, right? So let's see what happens exactly. We have these cells which are present in the body, right? These cells, they have certain channels present on either sides of the cell membrane, we can assume, right? On one side, they have the ligand gated channels, okay, and there are the voltage gated channels. Okay, these ligand gated channels and the voltage gated channels, they regulate the influx of the calcium inside the cell, right? The ligand gated calcium channels, they are maintained or regulated by the hormones and the neurotransmitters of the body. The voltage gated channels, they help in the normal physiological functions of the muscles, the nerves, and the electrophysiological changes of the body, right? What happens because of this? There is good influx of calcium inside the cell, okay, and normal levels of intracellular calcium is maintained inside the smooth endoplasmic reticulum and the mitochondria. Whenever these levels increase, there is apoptosis of the cell due to increased intracellular calcium. And to regulate this, there are certain channels on the either side of the membrane of the cell, which are the ATP dependent sodium calcium exchangers, right? They will regulate the outflux of the calcium when there is increased levels of calcium inside the cells. Okay, so now let's see what happens when this number or the extracellular calcium in the blood actually exists. Okay, the extracellular calcium, it is present in the blood, simple to understand, and the interstitium, right? They are present in two types. One is the diffusible type, the other part is the non-diffusible type. Okay, the diffusible type is the free calcium because it is ionized. Its ionic formulation or the molecular composition is of smaller size. That is why it is diffusible. Simple to understand. And it is present as the diffusible calcium, which helps in the neuronal action potentials, the muscle contractions, hormonal secretion, coagulation of blood. Okay, because of all these things, because of the diffusible calcium present in the blood, these type of processes helpful. They help in these type of processes. Now the non-diffusible calcium, it is present bound with the albumin, right? So this is what actually happens as a normal physiological process of the calcium by the voltage gated and ligand gated channels. How the extracellular calcium, which is important as ionic calcium as we saw, which are helpful in these processes, and there is non-diffusible calcium which is bound to albumin. Okay, now this particular figure which we see here, it is important when the calcium levels change in the blood, right? Whenever what happens, there is a reduction in the calcium. Okay, whenever there is reduction in the calcium, what happens, there is a release of parathyroid hormone from the parathyroid gland, right? Which causes what? Which causes bone resorption, right? Which will cause an increased levels of calcium. And what happens because of that? There is absorption of calcium. Okay, secondly, what happens, there is whenever calcium levels in the body decrease down, right? Whenever there is increased excretion from the kidney, what happens because of that? Kidneys secrete calcitriol. The secretion of calcitriol, which we call is at active vitamin D, the absorption from the intestines increase, right? This is what actually happens when there is reduced levels of calcium in the body. These are the values which you can remember if you want. Now what happens, as I just told now, what happens in the calcium homeostasis, there is the release of parathyroid hormone, which will induce the bones, or which will cause the bones to release intracellular calcium or ionic calcium in the blood. The 128,5 dihydroxycholecalciferol or vitamin D3, this will cause increased secretion or increased absorption of the calcium from the intestine, and there is calcitonin, right? Now this in the graphical format, which in the written format, which we have seen just now, the same thing. Okay, then the parathyroid hormone, there are 4 parathyroid glands which causes increased serum calcium by bone resorption. Calcitriol, which helps in active bone formation. The main effect is on the gut, as I just told now, increased calcium absorption from the gut. And calcitonin is something which is secreted from the parafollicular cells of thyroid hormone. It causes increase, opposing the effect of parathyroid hormone. That means whenever there is excessive release of calcium, excessive bone resorption, calcitonin will tell the parathyroid hormone to reduce that bone resorption and maintain the levels of calcium in the blood. Right. Now, what is hypocalcemia? Now, the definition actually says, I remember the levels of calcium as 9 to 11 milligram per deciliter. Okay, but the standard definition says a serum calcium level of less than 8.4 milligram per deciliter with a normal serum albumin. This is an important line here, the normal serum albumin. Okay, albumin level should be normal. If the levels of albumin are deranged, it will lead to pseudo hypocalcemia. I will tell in the later slides. Or the second definition says an ionic calcium or ionized calcium less than 4.2 milligram per deciliter. These two definitions say the definition of hypocalcemia. Now, what is pseudo hypocalcemia? Okay, this is actually happening whenever there is reduced albumin levels in the blood. How this happens? Remember this. Whenever there is alkalosis, because of alkalosis, what happens? Few H plus ions are present in the blood, right? And we all know that albumin is negatively charged ion, right? Now what happens is, when there is few H plus ions available, okay, freely availability of negatively charged albumin is more in the blood, right? So the free calcium or the ionized calcium bounds with the negatively charged albumin, causes more bound calcium and less free ionized calcium, right? Which will cause hypocalcemia. So the amount of or the levels of albumin is important in this, right? Which we have seen, pseudo hypocalcemia describes the situation in which the total calcium is reduced due to hypoalbuminemia. Okay, but the corrected calcium and ionized calcium remain within the normal ranges, isn't it? The total calcium levels in the body will be normal, but there is a reduced calcium levels due to reduced albumin levels. The free albumin or the free calcium is not present in that much amount of the body, so it will be known as pseudo hypocalcemia. Okay, so the corrected, this is a formula, corrected serum calcium equals measured serum calcium plus 0.8 into 4 minus serum albumin. This we will discuss in the treatment part, how this formula is useful in case of pseudo hypocalcemia. Now, what are the causes? So we all know calcium levels go down whenever there is decreased intake, okay, or there is increased loss. Okay, decreased intake as in case of malabsorption or any case of kidney disease or irritable bowel disease or any small bowel bypass, any short bowel syndrome, any vitamin D deficit, there's decreased absorption or reduced secretion of calcitriol from the kidney, right? Because of these things, there will be decreased intake or absorption of the calcium. Increased loss in case of alcoholism, right? Chronic kidney disease, because there is reduced secretion of calcitriol from the kidney, reduced absorption from the gut, and there is diuretic therapy. We all know the loop diuretics causes reduced calcium levels in the blood. It will cause increased calcium levels in the urine, so that will be more excretion of calcium from the kidney, right? And there are certain endocrine causes, right? The endocrine causes being hypoparathyroidism, the reduced secretion of parathyroid. It wouldn't be able to stimulate the bone to reduce that much amount of calcium. Okay, post parathyroidectomy, same concept. Parathyroid hormone is less, there is reduced secretion of parathyroid hormone, there is reduced bone calcium release, and that will lead to hypocalcemia. Pseudo hypoparathyroidism, another cause. Calcitonin secretion with medullary carcinoma of thyroid. As I told, calcitonin will cause reduced secretion of parathyroid hormone, reduced secretion of calcium later. Okay, and if there is familial hypocalcemia due to any genetic cause, right? And there are certain associated diseases, as I told, that increase intracellular levels of calcium. Whenever there is increased intracellular levels of calcium, like in case of inflammation, and in case of inflammation like pancreatitis, or in case of rhabdomyolysis or septic shock, there will be increased apoptosis, and there is increased levels of cell death, reduced levels of calcium in the blood, right? Physiological causes associated with decreased serum albumin, which I just told, hypoalbuminemia leading to pseudo-hypocalcemia, decreased end organ response to vitamin D due to reduced, any kind of irritable bowel disease, hyperphosphatemia, and it is induced by in some antibiotics and lobe diuretics, as I told, and certain drugs like foscarnet. Okay, so now what happens in case of hypocalcemia, how this particular disease causes the clinical features. Okay, I've written a line here. Clinical manifestations vary with the degree of hypocalcemia and rate of onset. That means reduced levels of calcium up to a certain extent will not show the symptoms or signs. Okay, there are certain manifestations I'll tell. You'll remember acute severe hypocalcemia, it can cause laryngospasm, confusion, and seizures. How? Let's see. There is vascular collapse with bradycardia and decompensated heart failure. There is acute or moderate hypocalcemia. It may cause increased excitability of nerves and muscles, causing circumoral or distal paresthesias and tetany. Okay, what exactly happens whenever there is reduced calcium levels in the blood? The explanation of these points: the reduced calcium levels of the blood will cause what? Increased release or increased activation of sodium channels, right? Increased activation of sodium channels on the membranes. Because of these things, these reasons will follow. Okay, increased activation of sodium channels will cause increased excitability of these particular structures, the larynx, the brain, the blood, and all these things, all these structures. Because of that, there will be these clinical features: the laryngospasm, the seizures, the increased excitability of nerves because of increased activation of sodium channels. Now there is something which we call latent tetany. Okay, the same reason which I told just now, increased activation of sodium channels will cause increased excitation of the nerves. Okay, because of that, these signs will be seen in the patient. When is the Trousseau's sign? What is this? You take a blood pressure cuff, you inflate above systolic pressure of the patient, you measure normally for 3 minutes. What happens because of that? Due to hypocalcemia, there is increased excitation of sodium channels, and there is development of carpal spasm. Okay, that is known as the Trousseau's sign. Chvostek's sign, it refers to twitching of the facial muscles when the facial nerve is trapped anterior to the ear, and these signs are known as the latent tetany. This structure or the figure will be shown about the Trousseau's sign, okay, in which there is carpal spasm. Okay, there is a flexion of the wrist, the flexion of the metacarpophalangeal joint, okay, the extension of the interphalangeal joint. This is the Trousseau's sign which we see, right? And now the last thing, which is mnemonic, and my favorite, the spasmodic mnemonic. The features of hypocalcemia: the spasm or the carpopedal spasm of the Trousseau's sign. There's perioral paresthesia. The patient will be anxious, irritable, irrational. There will be seizures. Okay, increased muscle tone in the smooth muscle. There is increased colic. There can be wheeze. There can be dysphagia. There can be laryngospasm. Okay, orientation is impaired. The time, place, and person, and confusion. There can be dermatitis. There can be impetigo hertiformis, and there can be Chvostek sign, chorioathetosis, cataract, cardiomyopathy, long QT interval on ECG. Okay, these structures or the clinical features we will be seeing in the upcoming video or the part 2 of the video. Till then, have a good time.